and it can increase your chance of stillbirth. The main sign of it is itchy palms, itchy bottoms of the feet, which are not usual places to itch. Yeah. Itchy belly is not one of the signs of it. Although sometimes they'll do this and then it just like extends to their whole body. They're just itchy everywhere. Kira said, I'm due January 15th. It's such a long process. I'm over it. I bet. Kira, have you taken a birth class? You still have time. It's a perfect time to get one in. If you haven't taken one, I know a lot of people will think they're too late. Like they haven't taken the birth class yet. They're just screwed. And you can be worse, like more wrong. So, my birth class is available in case you still need one. It's the online prenatal class for couples. You can find it through my link or anywhere. But if you guys have questions, go ahead and ask them in the comments. I would love to answer. That's what we're here doing today. They are so far from me and I don't have a reliable driver. So Kira, that's why I created the online prenatal class for couples. It is available online 24/7 and you can take it whenever the heck you want. It takes just under 3 hours to take the main part of the class. It is $89 for the main part, but if you use coupon code PREGNURSE, you can get 10% off. So that makes it just under $80. Yeah. So if you guys have more questions about my birth class, let me know in the comments. Does labor go by faster with your third baby? Due with my third in July. Great question, Mama Rachel. Early labor often doesn't. Early labor can be tricky and doesn't always go much faster, but usually the later labor, active labor goes faster, and also pushing is much faster. So those are the two that usually go a bit faster. Active labor, but it can depend. Like my first baby was 7.5 pounds, and then my second baby was 9 pounds. And so that I ended up having to push a little bit longer, probably not longer. Anyway, it sort of depends on how that second baby is. Do you recommend baby aspirin in early pregnancy? Great question, Zana. I recommend talking to your provider about it. It is recommended for anyone who has an increased risk of preeclampsia, which is like a lot of people. But there are people that should not be taking aspirin. So that's something you definitely want to talk to your provider about. If you have an increased risk for preeclampsia, pregnant with multiples, higher BMI, history of mom or sisters having preeclampsia. Those are ones that are coming to high blood pressure. Then they do recommend that you start it by about 12 weeks of pregnancy. So I'm a big fan of it. I've looked at all the studies. Aspirin was a big no-no when I started in labor and delivery. So when people were coming in starting to say that they were being recommended it, I was like, what? So I read the studies. I read even more studies. I actually did a campaign with the March of Dimes about this, read even more studies with them. Always thought that it would make you bleed more or have complications during your pregnancy. Absolutely does not. It decreases your chance of getting preeclampsia, or you get it later, or you get it not as severe. So huge fan of it because preeclampsia is a huge issue. I'm not going to be scrolling back up to look at questions today. So if you have them, just keep putting them in the comments if I haven't answered. Question, I have low iron. I've seen a supplement that I can drink instead of a pill. Is that okay? As long as the supplement actually includes the ferrous sulfate that you need, it should be fine. I would just caution that it is probably going to taste real bad. If it was me, I would try and take a pill. Because babies have to sometimes take iron drops, and boy, oh boy, they do not smell good. So I don't know. Yeah, but if you're drinking your prenatals, gummies for prenatals, as long as the prenatals have the medicine that the supplementation that you need, the milligrams or whatever, and they've been third-party tested, because as you guys know, the FDA, at least in the United States, doesn't actually say, they don't have anything to do with supplements. So they don't say if like there's enough folic acid in something or whatever, like they don't do anything with that. So yeah, a lot of people can't do it because they can't swallow pills. So that makes sense. I'm just telling you to be prepared. Callie said 4 days late, tested negative 2 days ago, but flutters White discharge, what does that mean? So you wouldn't be able to feel baby at 4 days late. I really don't think. Most people aren't feeling their baby, especially on their first, till closer to 20 weeks, maybe 16 weeks. So I don't think that that's it. It could be gas or something else. Yeah. So if you haven't had a positive pregnancy test, I always recommend just waiting a couple days, trying to test first thing in the morning. That's when the HG's highest concentration in your urine. Guys, I won't be answering if you're having a baby or not, because I only do that if the baby's coming out. I never guess. Yeah. How to get pregnant if you've been trying for 7 months. So the average time of trying to get pregnant and not before getting pregnant is 9 months. So I would just keep trying, make sure that you're doing it frequently, you're making the attempt frequently. Yeah. Chance of a VBAC almost 6 years after cesarean. Great question, Keiko. It is really important that you talk with your provider, because this really varies person to person, depending on why you had your first C-section and what you're experiencing on this next pregnancy. So I can't really give you an overall ratio. Obviously, it's been a while since you've had a baby, so your uterus should be nice and well healed. However, if there was a reason that you ended up having a C-section that would also happen this time, then, high. But if your baby was breech and this baby's not breech, then low. Yeah. What's the signs of having multiples? 2 babies in the womb, two heart rates. There aren't other signs that I know of that I've looked into studies beyond that. Reaction due to epidural. Not sure what the question is. Doc says it's luck. About getting pregnant with twins. I have no interest in having children. My doctor says he won't tie my tubes till I have one. Interesting. And they won't renew your birth control. I would find a new doctor, personally. I don't know where you are, but I would find a new doctor, because that is weird. I've got to admit that when I see like a 20-something-year-old getting their tubes tied, I always worry that they're going to regret it later on. But people got to make their own choices, I guess. Miscarried at 16 weeks in August and then miscarried again 5 weeks in November. I'm 39. Advice. I'm so sorry. There really isn't that much that we can do about miscarriage. You could talk with your provider about like maybe progesterone shots, although the verdict on those seems mixed. So I'm so sorry. Definitely talk with your provider, see what they recommend. Opinion on ADHD medications while pregnant. It depends on the medication. There are ones that are better or worse, so talk with your provider, and then you have to weigh the risks and the benefits of taking the medication during your pregnancy. How can I make labor easier without having an epidural? Mima, have you taken a birth class? Mama? I think it's Mama. Have you taken a birth class? I would 100% recommend doing one of those, because you're going to need to, like in my birth class, I go over lots of different natural pain management techniques, including breathing, massage that your partner can do, other things that you can do, and also ways you can labor to make it easier to not get an epidural, which includes going to the hospital later. So I talk a lot about what you could do at home while you're waiting to go into the provider. Oh, Felicia, I'm sorry. The doctor said it was luck with the miscarriages. I mean, it may well be. Have they done like the basic lab work? I would guess they have if you're 39, as far as like thyroid, basic hormone levels, things like that. Could always find a second opinion. No, I've had 2 kids, but I don't want another epidural again. Yeah, well, I would still definitely, I actually recommend everyone take a prenatal class. That's why I have like a beginning level, a main level that's like the awesome one for refreshers. And then there's another level that includes like breastfeeding, baby care, baby sleep. People that have already had a baby usually don't need that second level, but a lot of them really enjoy it too. How am I not getting pregnant, but there's no signs of me being infertile? I mean, the signs of being infertile is not getting pregnant. So it's tricky. Yeah, Felicia, good luck. That is tricky. I would maybe look for a second opinion. I don't know if you're going to OBGYN or like a family practice. It's hard to say. Even a family practice can help you in that kind of a thing, because it's a lot of basic stuff unless you want to go to a fertility clinic. All right, looks like we're out of questions. Anybody else have any? questions for me? Instagram. You can ask questions too. I'm live on Facebook, Instagram, YouTube, TikTok, obviously. Yeah. In case we haven't met, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm the creator of the online prenatal class for couples, the easy way to get prepared for birth. It is a virtual birth class that can be taken 24/7 wherever you are. You can do it on your couch, which I think is so nice. It is also one of the best priced birth classes out there for one that covers from pregnancy through delivery. And if you look at the price and it is really not something that you can afford, please email me. I would love to figure out a price that will work for you, or some payments or something like that. So let me know. Signs of infertility. I mean, I don't really know the signs of infertility other than that you can't get pregnant. How long did it take for you to become a labor and delivery nurse? What was the process? So I got my RN, BSN in college, and then you can go straight into labor and delivery if you can get a unit to hire you. A lot of units hire new grads lately. I worked pediatrics, geriatrics, and hospice for 3 years, and then I moved into labor and delivery. What happens if you and your husband are sick when you go into labor? You still have your baby. We might ask you to wear masks in the hospital. I don't know what they're doing as far as COVID testing in your hospital right now. Some hospitals are being kind of still sticklers about that and might ask dad not to be there. I don't know. How do you know if you can't get pregnant? You don't, Angelica, you just don't get pregnant. I don't know. Positive GBS test. So yeah, usually around 36 weeks, your doctor will insert a swab into the birth canal, and well, it's really on the outside and also into the boob canal, to check for a bacteria that is absolutely normal. It's not like an STD or anything like that just hangs out in that area. But somehow researchers figured out that babies who are born to moms who have that bacteria are more likely to end up in the NICU and have serious problems. And so we do that GBS test. If it's positive, that means during labor, they're going to try and get antibiotics in at least 4 hours before delivery. We want to have 4 hours to get that antibiotic in before baby's born. And then they keep infusing it about every 4 hours, depending on what antibiotic you're ordered, until baby is born, just to keep that birth canal clear of the bacteria. And then once baby's out, we don't care. We don't do it again. What is GBS? I had it with my second, and she was in the NICU for a few days. So it doesn't mean for sure that that's why your baby went to the NICU. It's just a very normal bacteria. Most of us have it on our skin. Beta strep. It's just hanging out there. And then doctors somehow figured out that it makes babies sick. So we test for it in the United States, but they actually do not test for it over in the UK. Yeah. Would your basic class be helpful for first-time parents, or would you recommend the upgraded class? I mean, it depends on your budget. Hillary, circa 2000, I probably wouldn't have been able to afford the upper budget. The other one has great stuff like breastfeeding. I have some basic breastfeeding in the main class, but not about like the latch. It's mostly on how to tell if it's not working and how to get help. It has baby care, baby sleep, nutrition. So if you can afford the upgraded class, I recommend that one. Remember, you can use code pregnant. I know PC10 at least works. PC10 will get you 10% off. So if you can afford the upper class, it's nice. The breastfeeding class is not taught by me. It's taught by IBCLC, who then you can get into their network, and you can do consults with her. You can take further classes with her. So yeah. Yeah, you're welcome. Mama Rachel, I also have a post on the pregnancy nurse. If you just type in strep, it'll come up. It might explain more. I don't know. It'll look at the studies and stuff too. So JJJ, if you have more questions about my class, let me know. I would love to see you in there. Do you have to have implantation bleeding to be pregnant? No, not everybody does. My doctor said my HCG levels are high. Is that actually high? I don't know. I don't know all those different things. Yeah, somebody had a pregnancy test, then a negative one. Anyway, best of luck to you. I don't know. I'm being induced to 37 weeks next week. Any tips for induction? Amanda, I 100% recommend taking a birth class if you are getting induced, because there are going to be increased interventions because of that. I just had a friend whose daughter got induced. She didn't expect how long it was going to be, was absolutely miserable, was begging for a C-section just a couple hours into labor, wasn't getting up, wasn't using movement to her advantage, and ended up with a C-section. And I just feel like that happens so frequently because providers really just can't give you all the information that you need in the office. So if you take a birth class, it really gets you prepared. The main tip I have for you is to talk with your provider about what they expect the induction to be for you and things you can do to help it move along. How can you keep moving? Is there anything you can do to start things at home? Some providers will insert a Foley balloon at home and then bring you in 12 hours later. I think that's awesome, because I think the more you can be at home in early labor, the better. Yeah. Anyway, best of luck to you. Please come join me in the online prenatal class for couples. If you look at it and it's out of your price range, please do email me, and we will see what we can do about payment plans and stuff. I have a whole lesson in there just on inductions that I think you'll find super helpful. I'm 36 weeks, have been having bad headaches, doesn't go away with Tylenol all the time, and blood pressure slightly elevated. Yeah, so have you been tested for preeclampsia? Shea? I think that's the big question there. Those sound like could be preeclampsia, could also just be hypertension. Have they put you on medication for your blood pressure? Those are my two questions for you. I have VCI, so I think that's developmental cord insertion. Hopefully, can I still have a natural birth without inducing? Yes. Yeah, you can do whatever you want. First off, I don't think they're going to want you to go late. So if you're going like overdue, they're really going to encourage you to not. However, you can still do NSTs, kick counts. I know they're going to do probably some Doppler flow testing and things like that to make sure that the cord is still pulsating good. Yes, you can have a natural birth. Hopefully you go into labor before your due date. But always the choice is up to you. Yeah. They tested me around 20 something weeks and it was negative for preeclampsia. Well, you're further along now, so hopefully they test you again. They might be just checking your urine along with your blood pressure in the office. And I guess if the protein isn't in the urine and yeah, then they might just be thinking that it's negative. But you could ask them, say, hey, are we going to do like pH labs sometime or preeclampsia labs? Just see what they're saying. Those same symptoms can also just be from high blood pressure. Yeah, but you definitely want to have an eye kept on all of it. All right, last call for questions. I'm just going to be finishing this. If I go to 36 weeks, slightly elevated blood pressure, do they induce me? Then I'm scared to give birth again. It is always your choice if you get induced or not. It depends on what your blood pressure is doing, if it's controlled, if there are other symptoms, if it's developing into preeclampsia. There's a lot of ifs there. Yeah. And then you just have to decide, is the risk that my doctor is telling me, is that worth it? Or do I want to stay pregnant for a little bit longer, keep doing kick counts, get NSTs, do PPPs in the hospital? It's up to you. I'm trying to do kick counts, but baby's all over the place, no real schedule. So are you in your third trimester? Kick counts start in your third trimester. Huge fan of them. You try and do them every time, the same time-ish of day. For me, I try to do them after dinner, mostly because then I didn't have to clean up. It was my third baby. On my second and third, that's when I did it. But I was hydrated, I was fed, and then you just feel how long it takes for baby to move 10 times. So baby's all over the place. You'll start to notice a pattern the more often you do them at the same time. So huge fan of kick counts. Did you know that it will save 1 in 4 stillbirths? It is a big deal, and so many people do them wrong. So yeah. Oh, Jenna, congratulations. VBAC. I'm currently new to pregnancy. I just found I was pregnant today. Any tips? Owned by Nathan. Congratulations. Well, obviously follow me. So many tips. Look on the Pregnancy Nurse. There's a first trimester tab that has so many great tips for you. How long should I be off birth control before starting to try? You can try right away. What is the number one thing that causes preeclampsia? They say it's your placenta. Risk factors include high BMI, diabetes, history of high blood pressure. I'm 37 weeks, absolutely exhausted, not experiencing nesting. Resting a ton does not, everyone not nest. No. Nope. I just saw a video where the mom was like, if my baby came out right now, I mean, you're 37 weeks. So if your baby came out right now, it'd be fine. But she was like 25 weeks. And she was like, if my baby came out right now, it would be like millions of dollars and tons of team members to try and get my baby to thrive. And here I am just doing it every day and also feeling like I need to do laundry. And I was like, yep. So rest. You don't got to nest. Work when you feel like you're going to work, but otherwise, no. So I think if you're perfectly healthy, your diet impacts your risk of preeclampsia. I actually was reading some study from like NPR. It was an article on preeclampsia. I can't remember what major news organization it was, but they were saying to decrease your salt intake will decrease your chance of preeclampsia, which is not true. None of the studies point to that being true. So losing weight does decrease your chance of preeclampsia, but there are plenty of very, very skinny women who end up getting preeclampsia. So my tubes were tied 3 years ago. I still haven't started my period. Last one was November 7th. I don't know. Took a test like Monday and it was negative. Oh, you mean your period's late? I don't know. Cat loves my hair. That is so sweet. Cat, I had my appendix out like 3 months ago, almost 4 months ago, and it is falling out. And I just got it cut, and my beautician said that that's normal after anesthesia, but I had no idea. And I'm trying to not lose my mind over it. I did, however, buy like $100 of hair care and a new diffuser. Okay, never noticed. Looks good, girl. Thank you so much. Thank you for the compliments, guys. I know a girl that was 19 years old, perfectly healthy, that preeclampsia and lost her baby. Yep. Look at Lady Sybil in Downton Abbey. Anybody seen that episode? Oh, all the tears. All the tears. So do you suggest doing kick counts after eating a meal, maybe breakfast and dinner? They really recommend just like one time a day. Otherwise, you're just kind of like monitoring the baby's moving. I do recommend it after a meal. I mean, okay, it's tricky because when people say my baby's not moving, I want to be like, just go into the hospital. But I also want to say, have you eaten and drank lately? Because it would be frustrating when we would have somebody come in at noon and say, my baby's not moving. Get him on the monitor. Baby's looking great. And then I'd be like, when did you last eat? And they're like, last night at 7 p.m. And I'm like, why did you not eat this morning? So we have to take care of ourselves, but we also need to make sure that baby's doing well. I'm not saying that you don't go in for decreased fetal movement when you're not eating, but I also think it's really important that we're still eating to make sure that baby's moving well and prevents us from having those false, scary things. Yeah, something about salty foods. I mean, she's 19. All 19-year-olds eat like crap, and most of them don't get preeclampsia. All of the studies I've read said that salt in your diet does not seem to have a thing with preeclampsia. Now, there are people that are sodium sensitive. Hypertension means that if they're ingesting salt, they will increase their chances of having high blood pressure. But that is a specific type of blood pressure, and not everybody has it. So, yeah. Somehow we apply that to everybody, though, and I find that super annoying. Anyway, looks like we have all the questions answered. Please come follow me here at the Pregnancy Nurse. In case we haven't met yet, hello, I'm Hillary. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and now I am your bump to bassinet bestie, where we help you get prepared for the rest of your pregnancy, labor, birth, and postpartum. Please do not forget postpartum. Please do not forget postpartum. I gotta tell you, Hillary took a birth class at my hospital. It was like so hard to get into. It was annoying to go to, and everyone's questions were annoying to be at, but I went to it, and they didn't prepare me for postpartum at all. So when you're taking a birth class, because I believe all of you should be taking a birth class, make sure that you take one that includes postpartum, what to expect postpartum, how to care for your body postpartum, how to be on the same page with your partner postpartum. Please take a birth class that covers postpartum. Thank you. Soapbox. Kick counts, getting prepared for postpartum. There's things that aspirin early in pregnancy to prevent preeclampsia. I'm always a fan. Oh, grilled chick nug. You followed you on my second account because it's a secret we're trying. Yes, I know. It's a big red flag. And I'm super active over on Pinterest, and I get lots of clicks, but I don't think that people save very often because they don't want that shown. And I get it. Yeah. previous shoulder dystocia for a 7-pound baby. Should I do a C-section next time? I mean, I don't think that they know, but most shoulder dystocias are caused often by baby's presentation in the birth canal, like they're in a wonky position, less so than their size. However, if your provider, like if it was a real hard push out, like there might be indicators that maybe your pelvis is just small to have a baby, and that might be your best option. Are you an RN? I am RN BSN. My kids love to know the BS part. Kids. Yeah. So talk with your provider, see what feels best to you. You don't have to make a decision right away, and you can always change your mind. Those are my best tips. Oh, no fistulas. That is the worst. I am so sorry, Sarah. I hope that surgery is super successful and you feel so much better once you're healed. Oh, yeah. In case you guys don't know what it is, when you push out a big baby, or really any, if you tear, there can become a small like tunnel between your poop hole and your baby hole, where things can travel between the two. So sometimes when you get stitched up, providers will stick their finger in your rectum to make sure that that wall is intact, so that you don't have to come back having the fistula later on. But it's a surprise to a lot of people. We used to have a doctor who would check everybody, which I think it's a good thing to check if you're sewing people up, but he would always go, finger in your bottom. Didn't ask. Ugh, doctors. Anyway. Thank you. I'm so nervous. 3rd degree tear left me with literally no perineum. Sarah, it will get better. I promise. I had a third, fourth with my first one, and it was miserable for maybe a year. I would recommend physical therapy 110%. So ask your provider for a referral right away so that you can get in, because sometimes it's difficult to get in to them. And I don't know how soon they would recommend seeing them after your surgery, but yeah. Oh, you did start physical therapy. Are you enjoying it? Like, is it helpful? I would love to know that. Pre-eclampsia almost took me out, rating my blood pressure over 200. No, none of that. We don't want any 300, 200 blood pressures. That's why they recommend low-dose aspirin by 12 weeks of pregnancy. Yes. Enya said, I'm 35 weeks today. Congratulations. Great time to get a birth class in. Sarah said about physical therapy, I love it. I only have one so far, but loved it. Unfortunately, since I'm getting multi-layer repair, only C-section from now on. Oh, interesting. I didn't know that. Oh, life. Anyway, thank you guys so much for coming and joining me. Thank you for the follows. Thank you for the likes. I super appreciate it. I hope everybody has an excellent day. Sarah, best of luck to you in your surgery, and best of luck to all of the pregnant mamas out there. I hope I will see you around. Make sure that you comment on my videos. And if there's something that you would like to see a video about, please put it in the comments on my videos so that I can make one for you next time. Bye.